So good morning, ladies and gents. Welcome to this third JIB webinar of the year, sort of focusing on the benefit scheme and particularly homing in on the My Bupa app. My name's Roger Horn. For those that don't know me, I'm head of membership at the JIB. Joining me today is Sam and Craig from Bupa, who you'll be sort of seeing shortly, and Rob from ECIS. Thanks to you all for joining today, interrupting your busy schedule in the middle of Storm Benjamin, I think it is, that's rattling through the country at the moment. Hopefully your fences are all intact. I'm not sure whether mine will be by the time I get home. For context, the JIB Benefits scheme, so that hopefully that is is a uniquely packaged scheme to look after the health and well-being of your employees who are covered under the JIB agreement. The scheme is a cornerstone of the JIB agreement and offers a comprehensive package of support. And we did a webinar earlier in the year, sort of focusing on this, with Sam and Rob. Obviously, Craig's joining us today. But following our webinar, there were quite a few sort of questions, both sort of by email, about the best way to access cover and treatment, because obviously there are a number of ways of doing it. And I think the My Bupa app is advisedly probably the best way to do that. It offers you the most options. So we decided to put on this session today, about an hour or so we're going to last, with experts from Bupa to go through the scheme highlights again, but also have a focus on the app, which is really a great gateway to get advice, treatment, and sort of kick off diagnostics. And then Rob from ECIS will talk through some of the private medical, sick pay and other insurance cover options and services that ECIS can offer. So we'll cover, you can see welcome introduction, deep dive into the app and highlights of the Bupa benefits. And then as I said, Rob will do a bit on the services that ECS can offer. The webinar is being recorded and it'll be placed on the JIB YouTube channel. Yes, we've got one. You might not have heard we've got a YouTube channel, and the slides will be made available after the session. There is a Q&A and chat facility, so feel free to ask questions as we go. We've got Q&A sort of sessions sort of built in, but if we can answer questions as we go kind of live, we will. So without any sort of further ado, let me introduce Sam and Craig from Bupa, who will talk about the scheme as talked about. So let me just stop sharing my screen.
Thank you very much, Roger. Everyone, so yeah, just following on from Roger there, so introduced us. So my name's Sam McGaw, one of the account directors here at Bupa. So look after your scheme, the medical insurance scheme that you have with us, joined by my colleague Craig Murray. And today, as Roger mentioned there, we're going to go through all things Bupa in terms of what the plan is, what the benefits look like, how you can access the policy, how you can make a claim, and then also pulling out what Roger said there about the My Bupa app. So we've got a couple of slides on what the app is, what it does and what it's designed to do to help you. And we've also got a demo, which we'll be going through a live demo sort of later on in the presentation, which gives you the look and feel, if you haven't downloaded it, the look and feel of what it is, what it's designed to do and what you can access on it. So the first part of the presentation is the features of your scheme. So essentially, when you sign up, if you're on cover, if you're looking to join the cover, essentially what the benefits are and what the policy is designed to do in regards to private medical treatment and cover throughout the UK. So the first thing to mention is at the point of joining, private medical schemes have what we call a form of underwriting. So the scheme that you'll join, the JIB one, is what we call medical history disregarded. So what this in essence means is when you join this policy, we won't ask you for any previous medical history. So that basically means that you're covered for any eligible, as long as it's eligible under the rules of the scheme. So where this differs with other policies, so if you went to Bupa as a personal customer, as an example, rather than through a corporate arrangement like this, we would ask for previous medical history, and then we would look to underwrite you based on the answers that you provided. I suppose one of the real benefits of a corporate proposition like this is because there's so many people on it, we're able to offer what we call the medical history disregarded, where we don't actually take into account any of your previous medical history. So previous medical conditions, as long as they're eligible for cover under the rules of the scheme, you would be able to claim for them where eligible and needed. So that's the first thing to mention, one of the sort of key points of the benefit if you're looking to join for from this year. And then the next point is the excess. So in terms of the excess for yourselves, a bit similar to how it works with other insurance products, you'll pay this excess, the rolling excess. You'll pay one excess per rolling 12-month period. So no matter how many times you claim, and this process applies to each member that's covered under the scheme. So if you've got your partner on there, if you've got any child dependents on there, the excess applies to each individual. And then the rolling part is essentially the scheme renews on the 1st of January every year. If you were to say have treatment and pay your excess in December, the treatment then continues into January and February. Our system is clever enough to look back 12 months to know that you've paid your excess in December. So you won't be due to pay your excess again until the following December when the rolling 12-month period comes. So this helps people particularly that are having treatment that spans renewal years. Whereas the sort of the standard offering really is what we call a standard excess, where your excess would renew and refresh every 1st of January, no matter when you are having treatment. So the benefit of this scheme is if you're having treatment that spans multiple years, your excess, our system would look back 12 months to the time where you last paid your excess as well. So even if you had paid your excess in the summer, if you need treatment again in the January, our system will know you've paid your excess within 12 months, so it wouldn't ask it for you again until that 12-month period has elapsed. And then you'll see on the right-hand side, so as Roger mentioned, this is being recorded. Example of how it works in practice as you've just gone through on the right-hand side there for you. The next thing to mention is, so one of the sort of fundamental benefits within the cover itself is what we call our mental health advantage proposition. So this is designed to help individuals on cover, whether it's anxiety, whether it's drug, alcohol abuse, workplace stress, home stress from home, or struggling with a bereavement, anything like that. The benefit is designed to help you with those mental health struggles. On various sort of settings, really. So we cover it on an outpatient setting. So if you want to see a therapist in an outpatient setting, or if you need to see a therapist from there, and also on an inpatient or a day patient case setting. So if it's particularly severe what you're going through, so particularly alcohol addiction is something like that, or drug abuse is something like that, where you might need an inpatient stay, the cover is extended to cover not just the outpatient therapy, but also the inpatient and day patient as well. We now cover most mental health conditions. Some examples of things that aren't covered are ones such as dementia, Alzheimer's, but in terms of the coverage, it's quite extended from where it was a few years ago. And then the proposition is also there to design to help support the physical and mental health in unison. So this is particularly useful if someone is going through a physical condition, let's say if they're feeling pretty low following surgery or an injury, or if they're going through cancer. Our team is there to support not just with the physical side of things, but also the mental impacts that can have on you and your family as well. So the advisors that you'll speak to are trained to help you navigate the policy in terms of if you are claiming for a physical condition in the first instance, they'll be able to help show you support from any of the mental health aspects that might come as a result of that physical condition you're receiving treatment for. Next slide, please, Craig. And then probably the far and away number one area of claiming the reason people use the private medical schemes is for the MSK coverage. So the muscles, bones and joints sort of options that you have. So we know at Bupa, through the data that we've got, if you leave a knee injury or you leave a bad back untreated, there's a good chance that it could turn into a more serious problem. So that's why our advisors are there and our options are there to help you tackle them as early as possible. So when you feel a niggle start becoming something that's becoming a bit more, that's when this benefit is designed to kick in. So we have options, so similar to mental health, outpatient options, so things such as physiotherapy, MSK physicians, podiatry, those sorts of things as options for you. If it is more serious, if there's surgery needed or day patient cases, MRI scans for MSK conditions, they're also covered where eligible under the benefit. So again, similar to the mental health, we're not just there to help with the outpatient stuff. We're there to help you, depending on what the injury is, to help support that as well. We have clinicians on hand to give you practical advice on how to aid recovery. So once you're post-surgery, for example, or post-physiotherapy, you can still get in touch with us to help with how to manage your condition, and also there to help advise on how to give you an informed decision if you do need treatment as you go through your treatment journey there. And we also offer treatment to suit your needs. So we've got, essentially, as we've just mentioned there, clinically proven physiotherapists right the way through to surgery. And you'll see at the bottom of the slide, within our network of health professionals, both Bupa clinicians and also with our third-party provider network that we work with up and down the country, a wide range of MSK options depending on what it is you're presenting with. As it mentions there, right the way through from physiotherapists and chiropractors all the way through to orthopedic and neurosurgeons. So the injury you're presenting with, the illness you're presenting with, is covered from there as well. Next page, Craig. And then the other one of the big three, really, sort of cornerstones of the whole proposition is the Bupa cancer cover, or what we call internally as the Bupa cancer promise. So this is essentially, if you're diagnosed with cancer, we promise to look after you as long as your cover has Bupa cancer cover. What this essentially means is there aren't any financial or time limits. So this essentially means as long as you stay on cover and as long as the policy keeps having cancer cover, you won't run out of funding for treatment midway through. So that gives you the peace of mind that your treatment can continue through that. One of the benefits, if you're looking at sort of cancer treatment through the NHS or whether to use this policy, is there are some drugs that are only available in the UK privately. So that is something to consider if you are diagnosed with cancer or anyone on the policy is diagnosed with cancer, just to weigh up your options. You can start your treatment off in the NHS and then transfer through to private. And we have seen it the other way, where you might want to start off private and transfer to the NHS. So our oncology team of advisors are trained and there to help you discuss all of the options that you go through, help you with whatever the consultant or the oncologist is saying. We've got our own sort of cancer nurse specialists that you can speak to at any time as you go through that journey. And we also offer treatment where you need it. So similar to where we mentioned for MSK and mental health, where we cover outpatient treatment, day patient treatment, or inpatient treatment, depending where you need it. For cancer, we go that step further. And where appropriate, if your consultant says it's safe and approves to do so, we can also offer things such as chemotherapy delivered in the comfort of your own home. So that is an additional option as you go through that. So you don't necessarily have to travel to hospital settings. You can, in some cases, have some of the cancer treatment in the comfort of your own home as well as part of this policy. And just building on the cancer support we offer. So we've just briefly touched on there are specialist oncology support teams, because we know as people go through possibly the worst time in their lives, you need that sounding board, you need that team of experts there to offer you the clarity, the advice, and the vital support as you make difficult decisions for yourself and your family. As we mentioned in the mental health section, you also get access to qualified Bupa counsellors as part of this. So you can take comfort that we're actually they're there to help with the mental side of things, not just the physical side of things of treating the cancer. We also offer the Live Well with Cancer program. So this is helping the individual transition from active treatment to going through and beyond cancer. So this is essentially signposting you to lifestyle advice, to support groups and that sort of thing, to help you make that transition from active to post-cancer treatment from there. And we know at Bupa, particularly where parents and grandparents are diagnosed with cancer, having those conversations with children to let them know what is happening can be extremely difficult. Our nurses and our clinicians have helped create a set of 4 illustrated booklets which can help you have those conversations aimed at children age 7 to 11. They've written obviously of a sensitive nature to help you have those conversations and how to communicate with children and that. So helping just to take an extra burden off you and the family from that perspective. And then for complex cases, We will also provide the individual with ongoing, dedicated and personalised support. So essentially, you'll get a case manager who will be there, your point of contact, your point of reference to essentially take you through the whole journey. As it mentions at the top, the clarity of the advice, second opinions, just making sure that you're clear on everything that you need to do. And also you'll receive the support from the same specialist clinician throughout your entire treatment journey. So that is that point of continuity as you're going through this as well. Some things so that are part of this. So cash benefits are an area of the policy that not everyone is aware of. So we offer 3 different types of cash benefits, and these are essentially if you're on cover, but you decide for whatever reason that you want to use the NHS rather than using the private benefit, there are 3 different types of cash benefit for you to consider. The first one is the NHS cash benefit, which is essentially we'll pay you £200 cash benefit for every night you spend in hospital, up to 35 nights per year. So if you're having treatment on the NHS rather than going private, and it would be eligible under the scheme, we would pay £200 for every night you spend in an NHS facility, up to 35 nights a year. For those complex conditions, surgeries that you might have on the NHS rather than going private, we pay what is known as a procedure-specific cash benefit. So if you're going through something particularly complex, like complex spinal surgery, heart surgery, those sorts of things on the NHS, you can speak to our advisors who will be able to detail if you're entitled to an NHS procedure-specific cash benefit, which can be different varying levels of lump sum cash that would be paid back to you based on what you're going through. And then the final one is if you decide to have cancer treatment on the NHS, we pay a separate cash benefit of £100 per day for every time you have cancer-related treatment. So whether that's inpatient, that could be radiotherapy, chemotherapy, for example, surgery, or whether that's outpatient treatment, we would pay £100 every time you use the NHS per day for that. And then just at the top left of the slide, you'll see there reasons for this are to help with things such as travel expenses. So if you've got to travel a particular distance, if you can't drive, if you've got to get a taxi, those sorts of things, they can help with those sorts of expenses to the hospital. We know NHS hospital, if you're staying there particularly for a number of days, the hospital car park costs can start adding up. So they could help with things like that. And also the unforeseen costs that come with childcare expenses if you're having surgery, for that example, and you need to stay in. These sorts of cash benefits are designed to help with those sorts of things from there as well. And then the next couple of slides are taking you through some of the sort of aspects of the scheme. So one of the things we offer is what we call our remote skin assessment. So essentially this is if you've got a mole or a skin lesion that you're particularly worried about. Traditionally, you'd have gone to your GP, you'd have got a referral, and then you'd have gone to see a dermatologist in person. To speed that process up, we now work with a company called Skin Analytics who can provide what is known as a remote skin assessment service, which can essentially help take pictures of those potential skin cancer, moles, lesions that you're concerned of. They'll send you a phone in the post. You'll speak to us. We'll give you this as an option. If you want to take it up, we'll send you essentially a smartphone that has a dermoscopic lens that you clip onto the back of it. You take a picture of up to 3 moles that you're concerned of. You follow the instructions on the screen. That will send those pictures, high resolution pictures, to a dermatologist. They'll look at them within a 24 to 48 hour timescale, and then come back to you either with an all clear that you've got nothing to worry about, give you a diagnosis of what they are. And if it is of concern, they will then give you the onward referral to go and see a dermatologist or an oncologist to go in person. So this is designed to help speed things up. In the majority of cases, give you the peace of mind that what it is you're worried about is not cancer. So give you that reassurance. And those cases where they are something to worry about, they will give you the onward referral, where you would then link back in with us, and we would give you the options of the dermatologist or the oncologist that you can go and see under the policy. So this hopefully speeds things up from that perspective in terms of getting you there. And then the next one is our rapid cardiac assessment. So again, we know at Bupa that heart health worries can't wait. That's why through this pathway, we can arrange for you to speak to a cardiologist within 2 working days of you calling from the comfort of your own home. All you need to do is call us if you're having chest pains, palpitations, heart sort of symptoms that you're worried about. Call us, speak to our team. They'll give you the options of what they do and how this works, what tests are available at home, and those sorts of things from there. And then as you'll see the next steps, they'll send out usually heart monitor, diagnostic tests. Your cardiologist will be in contact with you without you having to leave the home. They'll review the results. So if you've got the heart monitor on for a day or two, they'll check that result for you. And then if you think it's something particularly of concern, they can arrange a follow-up consultant. And the best thing about this is, depending on what they see, they can refer you to different types of cardiologists to make sure that you're seeing the right person the first time round. Whereas typically you go and see a cardiologist who might then have to refer you on. This is designed again to speed up that process for you. And then I'll hand over to Craig, who's going to take you through the next part, which is essentially, now you know the features of the benefits, how you can start applying them on your own terms, essentially, and when it's beneficial to you.
Thanks, Sam. Good morning, everyone. Great to be with you all today. So I'm going to spend the next couple of minutes talking you through the My Bupa app, and then I'll hand back over to Sam, who'll give you a live demo of the app, as we mentioned earlier on in the call. So first of all, as a Bupa member, you have access to My Bupa, and this is mainly where you can access all your private medical cover. There's lots of things you can do on there, so check your claims history, you can request treatment, and also access digital mental health support. This is also where you can access Bluer Health, which is where you'll find our virtual GP service. It's very easy to get going. All you need to do is download the My Bupa app to a smartphone or register an online account to create your account. Once you've created your account, you'll be able to see the details of your cover. And as mentioned, access lots of different things, and I'll talk you through them on the next couple of slides. So virtual GP appointments. So once you've downloaded the My Bupa app or created the online account, you will be able to access our digital GP appointments from anywhere. You're able to speak to a GP or another expert healthcare practitioner at a time and a location that suits you, with remote consultations with appointments available within 24 hours. There's also 24/7 access to our online symptom checker for fast reassurance and support on many symptoms that you may experience. And it's really easy to book an appointment within the My Bupa app, and using their service won't impact your access on the plan. Alongside the digital GP, we also have digital wellbeing support for you. So within the app, you access our digital wellbeing services, which include our fitness centre, where you can view and participate in on-demand or pre-recorded fitness classes, and also everyday wellbeing, where you can find guided meditation spaces and wellbeing articles and videos. If you're already a Bupa member and have not yet downloaded the app, I would certainly encourage you to do this. This is a great resource to keep everyday wellbeing and fit and healthy. Just going to hand back to Sam to share his screen to walk you through and feel the My Bupa app.
Perfect. So this is essentially a demonstration of what the My Bupa app will look like once you've downloaded it. So depending on what type of smartphone you've got, whether it's Apple, Android, you download it either from the App Store or the Google Play Store. Once you've downloaded it, it should fit on your homepage like this. So essentially, first time using this, it'll ask you the general things that most apps do. So do you want to allow notifications? Do you want to sign up with fingerprint or facial recognition, depending on what phone you've got? So that's, again, up to you. Once that's set up and you've logged in, so you'd log in, as Craig mentioned there, with your work email address for starters. The API that we use will then ask you questions such as your name, where you live, those sorts of things to help identify your new system. Once you've signed in, created your password, etc., this is what your homepage would look like. So as Craig mentioned there, you'll see the Bluer sort of digital health, which is the My Bupa sort of digital GP access. The digital appointment section, finding the right care for you. So if you need to speak to one of our GPs, one of our physios, etc., all the information's in there. The fitness center, so the fitness sort of classes and those sorts of things that you get access to completely free of charge are all in there. The everyday well-being, so things such as meditation, the mindfulness stuff that you get with Bupa is all in there. As you go through the app, Scroll down. All of your pre-authorizations from current or past will all be there. If you have a Bupa health assessment, your health assessment report will sit in there. Any previous claims, policy documents, anything that's related to you and your Bupa sort of policy will sit within there. So essentially, as Craig mentions, this is really the one-stop shop for everything you should need Bupa-wise. So documents, we'll have the numbers to call. If you click on the account side, anything that's relevant for you. So your medical cover will sit there. If you had a Bupa dental cover, it would sit there. Claims history, what benefits you've got. You can carry on clicking through. So as we go through, it'll have all your documents, so your certificate, your digital GP leaflet, what's changed in this policy year. It's got your pre-authorizations. So you know when you're contacting providers what the number is, so you don't need to have it on a text or post anymore. It's all done here and what it's for. Previous claims, so it'll show on here what you've paid, what you've claimed for, what we've paid, and this will help you identify what your excess will be charged to as well. So this should help from there, and we'll give you the information on who you would need to pay the excess to. So everything is now done via the app for you to make it nice and easy. And then the different services, who you've got on cover, is your address up to date, everything is done via the app. So the admin housekeeping is done through there. If we go back to the start, fresh back to the start. The other thing to mention, as Craig said at the start there, the digital GP journey. So through here, you click through here, this is how you would then book your appointments. If you've got appointments to join them, it would all show in here. So if you've already booked anything, if there's something where you need to speak to us, the mental health helpline there related is there to support you straight away. And then booking an appointment is pretty straightforward in terms of this. The first time you ever do it, we'll ask you a series of questions. So who's the appointment for? Are you registered with a GP or not? If you are, for the first time, we'll ask you the details. The next time you use it, we won't ask you again. So you can just update that as and when you change GP surgery. Have you got any past or ongoing medical conditions that our GPs need to be aware of? The first time you do it, you would just type in what's relevant to you, and we'd save that for you. Is there anything in your immediate family? If there is, what is it? And then this again would save for you. So you only need to do this once and then just update accordingly as new things progress. Medication, what is it again? Any allergies? What they are. So this just basically gives a record of you that our clinicians, when you speak to them, are aware of from there. And then your NHS GP details. Essentially, if you consent, we will share any details of the consultation directly to your NHS GP, so they have it on record and they're kept in the loop. So essentially, depending on what it is you're presenting with, so it's mental health, so it's anxiety, stress, if it's MSK related, so if you've got a knee injury or a back injury, or if it's something else, the app is designed to point you to the right clinician for you. So as Craig mentioned there, on the My Bupa Digital GP, mental health will point you to our expert mental health nurses who are the experts in that field. Muscles, bones and joints will point you to one of our physios. And then depending if you want to speak to someone about something else, this is how you would then access the GP. So it'll tell you what it is you're looking to speak to us about. If there's an image to show, you can add that there. So if there's a particular bit of like a rash or anything like that you're concerned of, you can use this. And then it'll recommend, based on what you're telling us, which clinician is best for you. So in this case, book with a GP. You would then just continue through. Do you want a video or an audio call? Do you prefer a male or a female clinician? And then here is where you would see the available times. So depending on what suits you, you can then book in a suitable time based on what's best for you, essentially. And then this would just be accessible via the phone as well. And then there's that consent bit at the end. Do you want us to share with your NHS registered GP the details or not of this consultation. And then that's essentially how you go about booking an appointment. Once that's booked in, we will then, if you've got notifications turned on, we will remind you that your appointment's coming up, and then all you need to do is access that via the app. So essentially, this app isn't just to access the admin side of the policy, so the policy documents, yes, it can be used for that, but it's also got all of the things such as the digital GP, the fitness center, so it's there ready for you to use and download from that perspective. So hopefully you all find that useful.
When I'm sort of like going through these sort of presentations, things where I'm talking to members, I think I've got a reasonable sort of knowledge of what's in it, but there's always like kind of new stuff that comes out when I'm sort of listening to the experts, so to speak. So that's great. But I'll hand back. So I kind of dived in a little early there.
Brilliant. Thanks, Roger. Yeah. So as you say there, Roger, I think where we've been, particularly from a digital perspective, if you were speaking to us 5 years ago, we might have been able to give you an app that would give you your policy documents and the basic sort of thing. But now, last couple of years, we've really motored on in that area, because ultimately we know for members such as yourselves on this call today, accessing healthcare needs to be as quick and as easy as possible. So this is the way we see doing that. And some people will prefer to call up. Some people will prefer to do it digitally via the app and those sorts of things. And I'll pass back to you, Craig, for the next bit on how to make a claim.
Cheers, Sam. Thank you. Can you see my screen?
Yeah.
Yeah, perfect. So initially on the scheme, if you've got any worrying symptoms of cancer or any musculoskeletal conditions, if you've got a sore knee, backache, what we would advise initially is to call us straight away. What we may be able to do is offer our direct access service, which essentially means without having to see a GP first to obtain a referral. In that, if we were able to offer the MSK direct access or cancer direct access, we would then be able to assess your symptoms over the phone. And if eligible, we would then be able to authorise the treatment without needing to see a GP. So as Sam mentioned there, it's getting that service a lot quicker and skipping a step out. If, we did need to obviously have a GP referral in place, then you could also use the My Bupa app to access digital GP. So if you do have any symptoms such as like concerning moles, anything like that, then give us a ring. We can look at our cancer direct access, and then any MSK conditions, you can also utilise our MSK direct access service. The numbers are on the screen there, but we will share that in the pack as well. And then again, any other symptoms that you may have before any treatment or tests, again, we would ask to give us a ring first to see if you can use our direct access. But if you do have a GP referral, then we would ask you to get an open referral. And what that means is when you call the helpline, we'll then be able to guide you to a relevant consultant or healthcare professional based on the recommendation from your GP. If your GP does have a particular consultant in mind and they give you a name referral, we can then check if that's part of the open referral network under your policy and look to authorise treatment. But always best to get an open referral, and then we can guide you to the most relevant and specialist condition in your area. In terms of open referral, I have just mentioned that, but what this means is on your policy, you have a choice of consultants that you're able to see. And usually what would happen is when you call the helpline and you have the speciality of that consultant, we would then guide you to up to 3 consultants within your area. And they are part of what we call the open referral network. There's many advantages to being within this network. So what it means is if we agree treatment with the consultant and say surgery is involved, our consultants within this network are what we call fee assured. And what that means is if you have any eligible treatment on the policy, we would then cover the cost in full with that surgeon. Without being in the network, we do have what we call non-fee assured consultant, and what that means sometimes is there may be shortfalls for you to pay. However, this is not applicable on your plan. If you see an open referral consultant and your treatment's eligible, it means that Bupa will pay this cost in full. And it's really easy to locate consultants by using our Finder website. The website's on the screen there. It's a really useful tool. You can also access it within the My Bupa app. And essentially what this does is it allows you to search for Bupa recognised providers, so whether that's consultants, physiotherapist practice, mental health treatment. It's anyone that has got Bupa accreditation and Bupa recognised. And it also lets you locate the ones that are in the open referral network. So really handy tool to look around your postcode, or whether that's your work postcode, and you are able then to select any providers within your network. I'll talk you through as well a couple of additional benefits that you have that are here for you every day under your policy. So as part of your Bupa cover, you also have access to our 24/7 mental health EAP service. So if you're not feeling yourself or something's worrying you, we're here for you. So you can contact us online or over the phone and speak to one of our experts in confidence. If you did prefer to contact us online, you can also do this via our web chat service and access online wellbeing resources for self-help. Additionally, we also offer confidential online mental health assessments where you can be guided to a range of support such as CBT therapy. To access this online service, you can visit bupa.com/CBT, and there's also a PIN code to use there, which is Bupa, HM in capital. And the contact number for EAP service is 0345 607 7777. You also have access to our Anytime Healthline. So if you have anything that is worrying you day or night, our Anytime Healthline is available to anyone covered on the medical benefit. The helpline is available 24 hours a day, 7 days a week, and for 365 days a year, with a team of nurses available to support you. The helpline nurse is there to support you with any health-related questions or any concerns, whether it's urgent or not. The helpline number is on the screen there, so it's 0345 607 7777. Additionally, you also have access to our Bupa Health Hub. So if you're wanting to be proactive about your health or learn more about a particular condition, our health hubs are available and packed with information from health experts to keep you on top of your well-being. We know menopause can be a challenging part of life, so we've also created a menopause helpline to offer guidance for support and advice to anyone who's covered on the policy. This is a free service with our specially trained menopause nurses. So this wouldn't erode any outpatient limits or any access on your plan. We can support with information about what to expect with the menopause, including health and diet or any exercises that can be done to help menopause symptoms, and obviously also mental health well-being related to the menopause as well. The helpline number is on the screen there, so it's 0345 608 1984. We've also got, as a member of the medical benefit Bupa, you have access to our family mental health line. So this has been set up in a helpline to help support anyone that you're worried about for any children's emotional well-being, which we are aware more and more children are experiencing symptoms of mental health. You can use this service even if your child is not covered on the policy, and our mental health nurses will be able to provide advice and can signpost to resources to help you and your family get the support that you may need. So if anyone's struggling with mental health within your family, I would encourage you to contact this helpline to get some support. And the last slide from us, so just an additional benefit that you also have as well, so you can feel the benefits of your scheme every day. This is called our Bupa Rewards Just For You. It's free to use and you can access discounts from things such as gym memberships and food subscription services. It's really easy to do and it's free. So if you just go to bupa.co.uk/rewards, and there'll be more information there on that website. And that draws us to a close of the presentation. I'll hand back over to you, Roger. I think might have some questions, a bit of Q&A if anyone's got anything they want to ask.
I think we've got a question in the Q&A. We've got a couple other questions as well. It was, how do you book a health assessment through the app? Is that can you do that?
So you can't book it through the app at the minute. So if you are interested in purchasing a Bupa health assessment, you just go onto our website, see what options are there, and then you'd be able to look at that from there. But when you do have your health assessment, if you just bought one from Bupa separately, the health assessment report that you'd get from the GP that does your health assessment would go into the app, so you've always got a record of it.
And just on that, and on the Bupa rewards, because I was looking at this the other day because I was telling someone about it. One of the discount, it looked like there was some discount available on the health assessment, sort of once you sort of registered through the Bupa rewards. Is that correct? Is that
exactly that? So that's one of the core ones that we always have on there is a discount. So if anyone's interested in having a look at our health assessments, the rewards platform that Craig just took you through will have different discounts. Some of the times on there is a discount of our own health assessments. So you just have that link and code for when you're purchasing your health assessment separately as well.
I think when you mentioned it the last time, I thought, well, I'm telling people about it. So I just had to go to look at the gym membership. And it was, I don't go to the gym. I didn't actually take it all the way through, but it was dead easy. You didn't have to sort of register per se. You kind of sort of set yourself up through the Bupa Rewards website. Takes you to a search area for like your local gym, and then when you present yourself at the gym for the first time, you present your logged in app or your certificate or something. So it really was quite easy. There wasn't kind of like complicated kind of sort of process sort of behind it. Okay, does the excess apply multiple times if you have multiple conditions?
No, it's per policy year. So as soon as that excess is paid for that year, you can keep claiming for different conditions regardless. It's just it would kick back in the following 12 months as well. So yeah, that's the only sort of stipulation from there. And it's per person that's covered on the policy. And essentially, depending on the excess level, you would, once that's paid, so let's say you had 6 sessions of physio as an example, once your excess is paid, we would then cover everything else in full as long as it's eligible up to if it's outpatient treatment, there's a separate outpatient limit, which is £1,750 a year. So then we would cover that. That's your limit for outpatient treatment per year. Whereas inpatient and day patient treatment would be covered in full.
Is that 1,750? Is that for things like I don't know, diagnostic tests and sort of things like
blood tests, outpatient consultations, physio, mental health therapy, you name it, anything on an outpatient benefit, that's what you've got per year. And then your excess applies, whether it's inpatient, day patient, outpatient, depending on what your first treatment is from there.
Okay. There's a couple from Amanda. Is there a fee for the online GP appointments?
No, completely free. Free of charge, unlimited appointments. It's just part of the benefit of having that on there. And then one of the new things the digital GP can do is if they think you're speaking to them about, let's say, a stomach complaint, and they think you do need to see a specialist, so in secondary care, they can start the referral journey for you to make that your life even easier. So they'll ask you at the end, they'll say something like, I'm going to refer you to a gastroenterologist based on your symptoms. Would you like me to start the pre-authorization journey for you? If you say yes, they'll basically process the pre-auth through our system without you needing to call. And then the pre-auth number and the recommendation of who you can see under the policy, so the consultants that are eligible, would then come back to the My Bupa app. So it saves you needing to get the referral off that GP and then ring up. The GP should take a bit of that heavy lifting off you, particularly for the less complex treatment pathways. And then for the more complex ones, we'd always encourage you to call in to talk through all of your options and that sort of thing.
And on that, before I answer the other question that Amanda sort of posed, your online GP appointment doesn't trigger the excess. Is it only when you get referred either by them or somewhere else that the excess is?
Yeah, so no excess for using the digital GP. So what we see now is a lot of people using it to get prescriptions, those sorts of things where you wouldn't need to necessarily use the traditional Bupa cover. The only thing there's a charge for is it's a private prescription. So when you go to the chemist to pick it up, you'd be expected to pay a private prescription charge. So that would just be whatever the cost of the medication is. So it's always worth double checking what the cost of that private. Sometimes it's cheaper than the NHS prescription. Sometimes it's more expensive. So it's always just worth double checking that. Because some of the medications privately can be quite expensive.
What's the procedure if you've been referred to a consultant by the online GP? not cancer or MSK, and after initial appointment, the consultant requests a follow-up appointment. Do you have to go via the GP again before booking this? Before booking this second appointment?
Yeah,
No.
yeah. So essentially, once you're in that secondary care sort of treatment, so let's say you've been referred, let's use the stomach example again. You've been referred to a gastro specialist by the online Bupa GP. Once you're in the secondary care, you've been referred, you've booked your appointment with a consultant that we've recommended. We would then do what we call a bundled pre-authorization. So we'd give you your initial consultation, any minor diagnostics that they might want to do, such as blood test, that sort of thing. And we'd cover the follow-up consultation as part of that first pre-authorization. When you go to your follow-up consultation, if there's something on those blood tests or those minor diagnostics where the consultant thinks, right, we need to investigate further, there's something more that we need to do here, they would tell you what the treatment plan is. So I want to do this scan, I want to do this surgery, whatever it might be. At that point, once you know what the consultant's plan is, you'd get back in touch with us on the helpline, let our advisors know, and they would tell you what's eligible under the system. And if it is eligible, they'd give you a new pre-authorization code to cover what that next step of the treatment journey is. And then you just give that to your consultant, book in with them, and then just carry on from that perspective.
Fabulous. We have got a couple more questions, but I'm conscious I'm going to sort of bring us back onto the agenda and perhaps get Rob back on to do his sort of session on the ECIS benefits and come back to questions again at the end. And we will definitely pick up Anna and Anonymous. We'll pick up your sort of questions sort of towards the end. So that's great. Sam and Craig, really fascinating sort of stuff. As I say, I learn something every time I sort of hear you guys sort of speak, and obviously the services, the digital services are just, it's growing obviously all the time, and that the convenience that comes with that and being able to access things. Rob, over to you.
Good afternoon. Thanks for having me along. So I'm Rob Lowe. I work for EC Insurance Services Limited. We're the organisation that provides the insurance benefits for JIB operatives and staff. I've worked in private medical insurance for just a couple of months, over 20 years. So I'm very experienced in this marketplace generally and how the schemes work, having also worked directly for a private medical insurer in the past. And who is EC Insurance Services Limited? We're a chartered insurance broker. We've received chartered status from the Insurance Institute, the Chartered Insurance Institute. Sorry, I forgot the word chartered in spite of having just used it. And we've been providing employee benefits to electrotechnical companies for about 40 years. We now cover around 1,000 member companies on the insurance products that we provide. I've been asked to talk about cover for dependents of JIB operatives. So the cover that is available specifically for dependents, private medical insurance benefits for office staff of JIB member companies. So that would be other staff employed by the company aside from their operatives. Sick pay, so the sick pay benefit that's available to operatives, death in service benefits that are available to operatives, and we'll cover some questions and answers at the end of that if there are any. So how does sick pay work? There is up to 50 weeks sick pay in any 52-week period available to operatives. And that's paid in addition to statutory sick pay, so it doesn't replace it. And there is a 2-week waiting period. So there's no payment made for the first 2 weeks of a period of illness. There is a qualifier to that coming along. So payment for waiting days 8 to 14 is made retrospectively after 8 weeks continuous absence. There's no payment for days 1 to 7, but if an operative is off sick for 8 weeks or longer, then, as I say, payment of week 2 is made retrospectively, should that be the case. This table shows you the amounts that are paid, and for the various different grades of worker as well. This is all covered in detail in the JIB handbook, which of course is available on the JIB website. And the relevant part of the handbook, should you want to take a look, is section 9. So that gives you the details both of the private medical insurance cover, sick pay. There is payment for disablement as well. There are various payments available for different types of disablement covered within the handbook. We're not covering that here today, but if you want to learn a bit more about it, the handbook will give you that information. Death in service cover. This has undergone some changes in the last couple of years to increase some of the benefits that are available. There's an accidental death benefit, so a death in service benefit of £40,000, and that's death by any cause at any time. There's a supplementary payment of £12,500, and that is in the event of the death that occurs as a direct result of an accident when travelling to or from work. So on the work commute specifically, after you've left the house to go to work, or when you're on the way back home from work. And that's a supporting payment of £12,500, which can be made in addition to that above payment of £40,000. So that gives you a total benefit of £52,500. Now, if there is a death that occurs as a direct result of an accidental bodily injury while at work, then the payment for that, replacing the commuting payment of 40k, is a one-off payment of £70,000. So as I say, that's for a death that occurs as the direct result of an accidental bodily injury that's sustained while at work. And together with the death in service benefit of £40,000, that makes a total benefit of £110,000, which hopefully will provide some support for loved ones left behind should that occurrence take place. We do also offer private medical insurance benefits for office staff and for dependents. But private medical insurance benefits, all of those that have been discussed by Craig, by Sam, are available for a separate payment for office staff of JIB member companies. And those office staff are billed yearly, and that payment can be made by interest-free monthly direct debit. We can provide more information for you about the cost of those benefits. Office staff and in fact dependents of JIB operatives or office staff don't receive the separate benefits, so sick pay, death in service, permanent or total disablement. Those benefits aren't paid, but they do receive the private medical insurance benefits. So as I say, for a separate payment, you can add dependents of JIB operatives, or you can add office staff of JIB member companies, and we'd be really happy to provide you with some more information about how that works if you'd like it. Just contact me or go to ecins.co.uk and click request a quote. Are there any questions I could cover at all for anybody?
I suppose probably more on the dependent cover rather than the office staff. Maybe it's treated the same. Is that a very kind of individually based, assessed sort of pricing? I mean, there's not a tariff sort of pricing, is it?
Cover for dependents is on an age-related basis. So there are age bandings for dependents depending on how old they are, and I'll just let you know a bit more about those because they are due to change. Okay, so the age bandings are, for example, a spouse under the age of 21, a spouse under 30, a spouse under 65, and then if you're adding partners and children, then it's spouse and children under 21, etc. And there is also a spouse and children over 65 option, should your spouse be 65 or over, with children under the maximum child dependent age of 24. So you can in fact add up to 10 children to the scheme. So there is a payment to make if you add one child. There is then no additional payment for up to 9 additional children. And I should add that employers can choose to purchase the full operative credit for their apprentices if they want to do that. They don't have to only offer the apprentice benefits. If they want to give it a bit of extra cover to apprentices, they can provide the same benefit that the operatives would receive.
You took the words right, because I've had a couple of members, I think, when they have apprentices get to a certain stage of their apprenticeship, they offer it almost like as an incentive or sort of something before they've actually qualified, but they're still an apprentice, and they offer then the full sort of benefit cover. But as you say, that's discretionary and up to the employer sort of thing. Before I go back to the sort of Craig and Sam sort of questions, just another one for you, Rob. In terms of claiming, so it's to do with private medical, that their relationship is going to be with Bupa, and in terms of sort of claiming. For anything else, do they do that direct with ECIS through the Canopy portal, or sort of calling you up? So then just make sure I've got my understanding, and for the audience, sort of kind
absolutely.
of correctly.
That's exactly right. Claims can be submitted via the Canopy portal, but for support with anything, I'd always encourage people with any questions, if they're unsure of anything, just to pick up the phone and give us a call. Like any insurance product, things always go much more smoothly when the insurer or the broker is involved from the outset.
Okay, fabulous. I think there was just a couple more sort of questions because we're coming to time. Well chaired, though I say so myself. There was a question around health surveillance and health checks. And probably this is more for the JIB / sort of ECIS. So the personal health assessment, and do interrupt me, Rob, if I get any of this sort of incorrect. We stopped offering the personal health assessment through Bupa. It was about 7 years ago, and we've introduced a much more sort of focused 10-point occupational health assessment for which you can claim some funding back via the Canopy sort of portal. I think I can. Feel free to sort of message me afterwards, or I can pick up with you sort of separately to give you a bit more detail. And then I think last, before I have a cream provided as a private prescription, but it ran out before the treatment ended. Can I apply for a repeat prescription? Would I need to get another online GP appointment? That's probably
So at the moment you would need to speak to the GP or the advanced nurse practitioner again and just get another prescription as it stands. Yeah.
Once again, thank you for audience. Thank you for Rob, Sam and Craig. So thank you a lot. Thanks a lot, everyone.
Thanks, everyone.
Great. Thanks all.
Bye-bye. Bye-bye.
Bye.